We live in one of the richest nations in the world, yet those living in poorer areas of our country die earlier and suffer years of more ill health than those living in our wealthier areas. The new NHS Alliance is looking to address these inequalities through health creation. Sue Saville explains how those committed to reducing health inequalities can be health creating by adopting one or more of the 5 features of health creating practices.
We all know about eating our 5 a day, but what about practicing our 5 a day? We can all change the way we work, using the strengths of people and communities to improve our health and well-being. Let's see these health-creating practices in action in Greater Manchester. The Lostock community felt forgotten and out of control. A central decision was made to close a clinic and there was no bus to transport people to the new health centre. Antisocial behaviour was also on the rise. For this community, it started with power shifting, leading to a true partnership between the community and public services, as residents took the initiative and started to share their expert knowledge on their locality with decision makers. Instead of complaining, people were sharing potential solutions. This sharing led to listening and responding. At first, it was unpleasant for the NHS, police and youth services to hear the truth about what was happening in the locality. But soon after, they started to see the residents as a source of knowledge and support. Next, it was time to tell the truth about the causes of the problems and what they wanted to happen next. Local people explained what was happening in their neighbourhood. The old clinic site was a magnet to vandals, so they wanted it to be sold and redeveloped. They wanted a GP practice, and they wanted to keep their local independent chemist. By opening up and telling the truth, communities and providers can get to the root cause of what's preventing health creation. Being listened to gave the residents hope, and they started focusing on their strengths. They stopped complaining about young people in the community and started helping them plan a new skate park. Designed by the community and built using lottery funding, the skate park is a well-loved and protected asset. More activities for young people even reduced levels of antisocial behaviour. This shows that by concentrating on what people can do for themselves or others, communities can fix things by focusing on their strengths. Service providers need to enable that to happen. The Lostock Community Partnership had come together to get things done locally. But this self-organising didn't stop with residents. Their actions made it possible for the independent pharmacist to buy the old site and build a new medical centre. He also persuaded a local GP to take up residence in the centre. Individuals can be helped to connect with each other and to collaborate and address their common issues together. When these 5 features are working, it provides the conditions for people to gain more of the 3 C's of health creation. People gain control, make contact and build confidence. The Lostock Community Partnership decided to take control, make contact and build their confidence in delivering solutions that mattered. The service providers embraced the 5 features of health-creating practices as a way of working with the community. So, over to you. Why not start by adapting your existing practices to include the 5 features, adopting new practices that are based on one or more of the 5 features, or if feeling particularly bold, find whole new solutions by talking to your residents or patients about what matters to them and finding new solutions together. Whichever way, you'll be practicing your 5 a day. And you'll be part of a growing movement tackling the injustice of health inequalities through health creation.